In order to beat breast cancer, I knew I would have to lose my breasts. But to reclaim my life, I chose breast reconstruction.
Each year, nearly 150,000 women will learn they will undergo a mastectomy due to breast cancer. But 7 out of 10 women are never told about their breast reconstruction options, and the numbers are even worse for minorities. That needs to change.
This living can't be called living if it's really only half a life. She's a flower that grows despite cement walls, and she will survive. She will survive.
I wrote the song Flower to raise awareness of this important issue. Breast reconstruction is a very important part of the healing process, both physically and emotionally, and all women should know their reconstruction options. Download my song Flower to share the message and help us share the knowledge that women can feel whole again.
With 2 young sons, Dana Van Gray is focused on making sure her family is taken care of.
Do we have track practice tonight?
Yes!
But after her second child, Dana decided she needed to take care of herself.
What I didn't like about my body was my stomach. I think all moms can relate to muffin top, especially with the styles now wearing skinny jeans and more fitted clothing.
Once mothers have completed having all their children, they're ready to restore the body they had before the children. They want their bellies tightened, this excess skin removed, the muffin top off, and they want their breasts lifted and sometimes made bigger.
2. Like 38-year-old Dana, plastic surgeons say mommies are having makeover procedures at younger ages.
More and more patients are coming in today asking for mommy makeovers because they hear more about it. They know we can now do it safely. The techniques and the technologies have gotten us to the point where we can do it as outpatients in a very safe and effective fashion, minimizing the amount of downtime and pain.
Dana waited just a year after her last child to have her mommy makeover and says she has no regrets.
Why wait? You know, I'm 38 years old, I'm young, I'm healthy, I want to look good now.
In Newark, New Jersey, this is Clark Powell reporting.
I put a map here, ready?
My story? I'm a former tomboy who grew up to be a model. Everyone has a story. And everyone should feel free to reveal their story. I want to tell mine without having to worry about my frown lines. So I talked to my doctor about Dysport.
Dysport is a prescription injection for temporary improvement in the look of moderate to severe frown lines between the eyebrows, glabellar lines, in adults less than 65 years of age.
Frown lines are just not me.
Dysport may cause serious side effects that can be life-threatening, like severe problems with swallowing and breathing. If you already have these problems before receiving Dysport, you're at the highest risk of complications that may be fatal. Don't have Dysport treatment if you are allergic to Dysport, any of its ingredients, any other botulinum toxin product, cow's milk protein, or have a skin infection at the injection site.
My doctor and I talked, and we decided that Dysport was right for me.
Tell your doctor about your medical conditions, including a disease that affects muscles and nerves like Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome. Any side effect from any botulinum toxin product in the past, a breathing problem like asthma or emphysema, weakness of your forehead muscles like trouble raising your eyebrows, drooping eyelids, or any change in the way your face looks. Tell your doctor about all the medicines you take and if you are pregnant or plan to become pregnant or breastfeed. The dose of Dysport is not the same as the dose of any other botulinum toxin product. Within hours to weeks after treatment, Dysport may cause loss of strength or general muscle weakness, blurred vision, or drooping eyelids. If any one of these happens, don't drive, operate machinery, or do other dangerous activities. Ask your doctor about Dysport. Typically, your doctor will first examine your muscles that cause frown lines. Dysport will then be injected into 5 sites above and between the eyebrows. Treatment usually takes 10 to 20 minutes. How does Dysport work? Over time, the muscles above and between the eyebrows repeatedly contract and tighten, causing wrinkles. Dysport blocks the nerve signal that causes these muscles to contract. This reduces the muscle activity in the treated area, ultimately giving your skin a smoother appearance than before.
I didn't want to change my looks, just my frown lines. Now my eyes tell my story, not the lines between them.
What about your story? You're here today. Why not talk to your doctor about Dysport right now? For special offers and more information, visit dysportusa.com.
Took about 4 surgeries to get here.
Kim Sport isn't shy about showing breast cancer patients her body. She had a mastectomy and reconstructive surgery at the same time and says she couldn't be happier with the results.
It was very, very important to share that experience with other women because I didn't want them just to have to look at a photo.
And a new survey from the American Society of Plastic Surgeons shows most women agree. The survey found 89% of women say they would rather see what reconstruction results might look like before making any treatment decisions. The problem is, not only are some women never shown surgery results, but 7 out of 10 are not fully informed about their reconstructive options. And by the time some women find out, it's too late.
I see a great number of patients who come in and say, I wish I'd known beforehand. I wish I could turn the clock back. But the problem is you can't turn the clock back.
To make sure women are aware of their options, ASPS member surgeons are planning a novel show and tell event in October to kick off the nation's first ever Breast Reconstruction Awareness Day, or BRA Day USA. The idea is to let cancer patients see for themselves what other women have been through. Singer-songwriter Jewel is lending her support as a spokesperson for the Breast Reconstruction Awareness Campaign. She's performing a charity concert and has also written an inspirational song to help raise funds for the campaign.
When I was writing the song, there was a lot of survivors that came to mind, and I'm always continually amazed at how resilient women are, and how when faced with a difficult position, they find the courage to say, I'm going to fight on, and I'm even going to be better. And that's what really made me write the song.
She's a flower that grows despite cement walls. And she will survive.
At the Center for Restorative Breast Surgery in New Orleans, this is Clark Powell reporting.